We're at the HSJ Integrated Care Summit, 2 days of intense but enjoyable debate, getting right to the heart of the issues with some of the most senior and influential leaders in integrated care coming together to develop their thoughts for the year ahead. The summit kicked off with a huge amount of discussion of productivity, which is clearly a really important subject at the moment for integrated care systems and integrated care boards, not only because they're under pressure over money and deficits, but also because it's going to be crucial to the NHS and care services getting any more resources for them to regain their credibility on productivity. Other big themes have been the importance of next year's spending review. There's a huge amount of anticipation about what the government will do. They say they're going to prioritise integrated care, but they've got a lot of big decisions to make about what that actually looks like and how they'll take it forward.
I think we're in quite a crux at the minute in the particular time. We've got the Darcy report. We need to take that forward, and it feels like it might be a turning point. We've yet to see whether policy follows that and allocations live up to that, but I think it's really good for us to now be at a new dawn of that in many ways, to say, well, how can we make that happen, and to share our thoughts with other fellow leaders.
As senior leaders coming in this space, having those open discussions, we have the ability to influence nationally how we want to see the policies develop so that we can really do what we want to do best for our patients. But coming to these summits, you can talk about things which nationally they can support you with and create those policies to get what you need for your patients and develop the services. If policies are not around it, if they're not wrapped around it, if your finances are not wrapped around it, you're just talking again, you're just not able to deliver it.
I was setting out our plans for how to develop the 10-year plan, and a core part of that is we really want to co-develop this with the public, with staff who work in the NHS and with leaders. Integrated care is a really important way to meet the complex needs of people that need health and social care systems to work really well together. We've got an ageing population, people who have got more multiple long-term conditions, so really joining that up, so services delivered around an individual is critical at this time.
If integrated care isn't working, is that a safety issue? In my view, it is. People with multiple conditions and frailty, they are the biggest reason for unscheduled admissions, for delayed discharge. So focusing our efforts on integrated care, which is what they need, is really important, and that has to happen at place and neighbourhood level.
My session was on the opportunities that social care could offer to the NHS and how we could work together to integrate care delivery as best as possible. There is more of a focus on there being a crisis in social care, whereas actually that narrative isn't necessarily helpful. And yes, there are some real challenges and local government is facing real financial pressure, but actually this is exactly the moment to be thinking about how we can work together to find some shared solutions.
The last couple of days have been really useful, particularly in connecting with suppliers who I get less chance to engage with directly normally.
It's been good to have open conversations. Everybody is thinking in the similar direction.
I've made several new connections, both within the NHS, but also with our commercial partners, and I've gone away with a headload of ideas. If one of those ideas comes off, that'd be great.